Good morning. I'm Dr. DeAn Strobel, and I'm here to talk to you today about hormone imbalances. So, a lot of patients come to me and they say or wonder, do I have a hormone imbalance? So, we're going to talk about a few ways that hormonal imbalances can affect women. Feelings of fatigue or being tired, mood swings, irritability, tension, lack of sleep, insomnia, or restless sleep, possibly with multiple awakenings, memory loss, loss of focus, or what some patients describe as having brain fog, decreased sex drive, difficulty with orgasm, depression, anxiety, afternoon fatigue. Some people will say they feel like they've hit a wall around 3 in the afternoon, hot flashes, night sweats, weight gain without changing diet or activity. Some patients describe a difficulty losing weight despite exercise and proper eating and just feel like nothing they do is working. Central fat deposition or that belly fat, and a lot of people will describe back fat, especially bulging around the bra line, joint pain, fibromyalgia diagnosis, migraines, or worsening migraines and severe headaches. So, how are these symptoms usually addressed? Well, many people start off with self treatment, so they're going to take energy drinks or B12 or drink alcohol to help them sleep or use uppers in the morning and downers at night, weight loss medications, etc. Or they may go to the doctor. What are the doctors going to do? Well, you're depressed, so here's some antidepressants. And then what happens? Then they have sexual dysfunction. Or I can't sleep. Well, here's some sleeping pills. Well, then that might make some conditions worse. They become addicted or they have sleep apnea or then they become sleepy in the next morning feeling hungover. So what about the weight gain or obesity? Well, okay, well, here's some weight loss pills. Well, we know those have risks now. And then what about the fibromyalgia? Well, are you going to get addicted to pain medicines and have that whole problem or there are some new medications that are for fibromyalgia that help some people, but then those can be expensive, or some people just don't want to be on prescription medications, and so on, so on. So, what are the facts? What are the facts about hormones? 3,500 women enter menopause every day. Symptoms begin up to 15 years before menopause. So most women think I'm only 25, I'm only 35, I'm not having hormone symptoms, I'm too young. That's not true. So most women are also affected in more ways than they realize, and many do not, well, most do not ever really get over it or get through menopause where they're just completely asymptomatic. In fact, it often becomes worse as time goes by, and the only thing that sometimes goes away are the hot flashes. Really, hormonal imbalance or balance affects all aspects of life, and with true hormonal balance, most aspects of life can improve, as well as long-term health. So, what hormones do women have normally? In your reproductive years, most women have three major sex hormones: estrogen, testosterone, and progesterone. We also make many, many other hormones, hundreds of hormones, but most people talk about thyroid hormone and the adrenal hormones, cortisol, adrenaline, things like that. So, what does estrogen do? Estrogen is actually present in both men and women, but in women it's in large amounts and in men in small amounts. But it has over 400 functions in the body. It controls hot flashes, it maintains bone density, helps maintain memory and lowers the risk of Alzheimer's and dementia, reduces the risk of colon cancer, helps maintain collagen in the skin, and increases serotonin and dopamine, which are the happy hormones in the brain. It also slows bone loss. Smoking and stress can, well, often lower the estrogen in the body. The natural form of estrogen in the body and the form that's used in bioidentical hormones is called estradiol, which does not increase the risk of stroke, blood clots, or cancer. So what is testosterone? Most people know that testosterone is a male hormone, and that's true, but it is also present in both men and women. It is present in large amounts in men and small amounts in women. But women start losing their testosterone very early. In fact, most women before they hit the age of 40 have lost already more than 50% of their testosterone production. Testosterone is very important for brain and for sexual thoughts, sexual function, but it also has other things. It helps with the joints, the bones, brain, breast, heart, and relationships. It does not make a woman grow a beard or a mustache, and it does not make a woman look like a man. It does not make a woman become muscular. Testosterone in the natural form does not increase the risk of stroke, blood clots, or cancer. So what is progesterone? Progesterone is also a very important hormone. It helps protect the uterus and is absolutely necessary in all women with a uterus if they're on estrogen therapy. But it also has many functions in the brain, bone, and breast. Many studies show it may help lower the risk of breast cancer when given in the natural micronized progesterone form. This is not to be confused with artificial progestins. These artificial progestins mimic progesterone, but they have an increased risk of cancer, stroke, and blood clot, while natural progesterone does not. So it is our preference in my office to use natural micronized progesterone. So how do I find out if hormones are causing my problems? Well, you're going to talk to your doctor and have your doctor check the test, or we'll be happy to see you. One of my physician assistants, Brooke Norwich or Lee Fisher, would be happy to see you as well as I can see you. I'm Dr. Strobel. How do I find out? Well, we ask you a lot of questions. We're going to ask a detailed medical and surgical history, detailed questions about the symptoms, including sexual dysfunction questions. After a thorough evaluation in the office, we will have labs drawn. This will include traditional routine labs like blood chemistry, blood count, and general thyroid, but we also usually draw several other thyroid tests as well as hormones, vitamins, and anything else that may be indicated depending on what problems you're having. So it's really important that we have all the labs that you've had done in the last year or so by any other physician or doctor's office sent to the office before your appointment, or you can bring those with you so that we will not repeat labs unnecessarily. Also, it will help us to see kind of what the trends are in your health care. So when will you get the results? If we're just drawing the normal routine labs that we get 9 out of 10 times, they're usually back in about 2 or 3 days. Now, some people, we have to draw even more hormones than are usually done, or more vitamin levels because of certain medical issues or complaints. Those may take up to a week. But most of the time, there are many, many things that are abnormal, or maybe not just perfectly in what we call an optimal range. So it's really important to schedule a follow-up appointment to review the results in detail and make a treatment plan for each abnormality. So what are the options? Well, there's no magic bullet. There's not one thing that's going to fit everyone. So it really has to be tailored to the individual as well as to the symptoms. So there are traditional therapies, which are called synthetic. We don't usually prescribe those. Those are what is covered by insurance, but that usually is just estrogen, or it's the artificial progestins included with estrogen, and I just don't want to risk those type of issues. So bioidentical hormones are the molecules that are made that are identical to what the body produces. So the studies that were done on bioidentical hormones so far have not found there to be any increased risk of cancer, blood clot, and stroke in bioidentical hormones. The only thing that does increase the risk of stroke is or blood clot, is when estrogen is given orally. So we try not to give estrogen orally very often due to that. So the creams, gels, patches, or even the subcutaneous hormone pellets, which we use a company called BioT, those do not increase the risk of blood clotting. So that is very important. A lot of doctors don't realize that there's a huge difference in the forms of hormone therapy as far as risk for blood clot and stroke. So there's a huge difference there. So what is the cost? Bioidentical hormones are not usually covered by insurance. So your creams run, it depends on where you're going to have them done, but for women, they run about $35 to $50 a month in creams. And the creams are given vaginally, are used vaginally most of the time. Now, there are topical creams, meaning those are creams you can put on your skin, but I'm just telling you that after years and years of doing this, most patients don't have as good of results, as good of absorption through their skin as they do through the vagina. Also, the best form of regulating the hormones, the one that's tends to be absorbed the best and tends to be more even levels, are the hormone pellets. Those are $300 for females. Now, that's per insertion. So the pellets usually last for about 4 months. So most women only need it done about 3 times a year and they don't have to do anything. So it tends to be very easy for them. Now the progesterone, there is a generic available in natural progesterone, and some insurances cover it, some don't. I usually tell patients, if you're paying more than $40 a month for the progesterone, then it's better to get the compounded form because that tends to have less side effects than the generic. It's a very good form, and it's about $35 or $40 a month, depending where you get it filled. So who can be tested? Almost anyone can be tested. We test males and females and almost any age. The other question we get asked a lot is, do we see patients from other doctors? The answer is yes. Many of our patients see a primary care physician or even another OB-GYN for their annual exam and their other needs. We are happy to see patients for hormones only, and we'll be glad to share any information found with your other physicians. I really believe continuity of care is very important. So we want to keep in contact with your other physicians and let them know what's going on. Now, this is the information how to schedule an appointment. You would just call our phone number, which is 903-957-0275. Our office is located in Sherman, Texas, off of Travis Street. You do have to go on the frontage road headed north, and you will turn on the first street past Burger King, and that's right here. Our office is behind some trees facing the street, so you will have to come in here and turn on into an entrance right around here. So we'll be happy to see you and check it out and see if we can find what's making you not feel your very best. Thank you very much for listening.